Good morning, everyone, and welcome. I'm Sarah Williams, President of Funeral Consumers Alliance. And during the Deathcare Superconference in Seattle on September 28th, I moderated panel 4, Models of Death Care. And we were able to meet examples of the most compassionate caregivers and grief companions. We heard how these brave models of inclusive and affordable care buck the status quo of overtreatment in medical settings and provide a new vision of how we can expand these offerings across the United States. Today, I'm finally able to catch up with Dr. Aditi Sethi Brown, who was unable to travel to Seattle because of Hurricane Helene. The serious devastation left her unable even to join us virtually. Aditi, welcome this morning, and thank you so much for doing this after interview with me so we can share with the attendees of the Deathcare Superconference.
Thank you so much, Sarah. It's lovely to see you and be here.
I'm going to begin by having you talk to us a little bit about your Center for Conscious Living and Dying. It's a real work of heart. And if you could please tell us a little bit about Omega Homes and this social model of a hospice home.
Yeah, thank you. So the social model for hospice is distinct from hospice. And when you look in the literature, you'll see that term social model for hospice used, and it's been used, but it can get confusing. So other terms for social model for hospice is community supported end-of-life care. And that's the term, the language we use often in our communities. During the AIDS crisis in the United States, individuals were no longer able to die in the hospital because of the overwhelm and the system, and then families would not take them in, individuals, because of the stigma associated with the illness, AIDS. And so this left many individuals with no place to go to die. And gratefully, individuals in their communities opened up their homes and brought them in. And mainly in New England at the time, these homes popped up and really opened up and invited volunteers to come and do bedside care for those dying of AIDS. And over time, these homes continued past the AIDS crisis and eventually formed this network called the Omega Home Network. And there are probably 40 homes in operation, 40 in development. You can go to the Omega Home Network .org website and look at a beautiful interactive map and see in your state if there is a home in operation or in development. And something to note about these homes is that they're all nonprofits. They're all volunteer led. Doesn't mean you don't have paid staff, but volunteer led. And they are they involve really providing the caregiving needs that hospice can't meet. So hospice comes into these residential homes, just like they would anybody's residence, and provides all the medical care. And then these Omega homes supplement that care, basically, providing, in our model, volunteers become like extended family. So they provide the 24/7 care that is often needed that hospice doesn't provide in the home. So in each state, there are different guidelines and regulations. So that the names of these homes may be legally comfort care homes or family care homes or adult care homes. There will be a designation based on your state and how they define these different institutions. You know, there's though the Omega home is really a home. It's not a facility, it's not an institution. It is a residential home. So that's the key. Um, in our state, if we have 3 people or less under one roof and we don't charge for services, then we don't have to be licensed or regulated, which gives us a lot of freedom. Once you get into the regulatory requirements, there are certain, nutritional things and activities coordinators and sprinkler systems you need. It becomes much more regulated and expensive, to be honest. And so this um, approach to end of life care, this offering actually it allows for individuals to meet the needs of their communities that are unique to each community and with some flexibility and creativity. Um, for example, we can offer the volunteers can offer medication management, can provide or administer the medications without a license. Doesn't mean we don't have safeguards in place and we have systems in place to ensure that it's done safely, but there's not all that oversight and bureaucracy really. So it allows human touch, and some volunteers in hospice programs are advised not to touch, or encouraged not to touch, or told not to touch a human that they're caring for, a patient. So in our setting, we have a healing arts team and an expressive arts team, and a lot of offerings, holistic offerings that can be provided to the individuals who are dying. So, do you have any questions, or shall I keep going?
Wow. No, that was what a contrast to like the medical hospice model.
Yes.
And a question that popped into my mind was, well, excuse me, how do you get the house? I mean,
That's a good question.
does a
So,
person donate their house, or does do a whole bunch of volunteers get together and buy a house?
yeah, I think if you talk to different communities, you'll hear
Mm,
different things, different answers to that question. I've heard the one that existed in North Carolina before us, we're the only operating one currently in North Carolina, um, and we're currently paused because of the hurricane. But the one in Mooresville, that was the Serenity House, they found a church that had a parish house that they weren't using. And they were able to rent it for $1, I want to say $1 a year or something. They found a creative way to find a property to use for this purpose. And that lasted for 15 years. Other homes are donated. Um, Other people, I've heard when I was traveling this summer and sharing film and doing Q&As, people came up to me afterwards and said, I've had this carriage house for years and I've always wondered what the fate of it was. Maybe I'll open a little home, and so it comes in different ways. Ours came with the generosity of a dear friend and a benefactor, David Case, who really supported the vision of CCLD, the Center for Conscious Living and Dying, really believed in what we were doing and believed that the property that we found through synchronicities and was really the place to land this vision. So he supported us to purchase it. We will rent to own or create a system where we can raise half the funds to buy the property and he'll donate the other half. So it's a real blessing. Um, yeah, I guess creativity is key
wow.
in this
Yeah.
conversation. Hmm. And I
Well,
wanted,
oh no,
oh,
go. You
sorry.
you
So I
go.
just wanted to add that hospice, how much did you all talk about hospice in the conference? Did
Well,
you
we had
chat?
a mobile hospice. We
Mhm.
had Lashana, that was Dr. G, her mobile hospice, and then we had the prison Humane Hospice Project, where the prisoners are training to take care of other prisoners at the end of life. And then Lashana with her home, where she takes in VSED or medical aid in dying patients. She
Wonderful.
also has a home setting.
Beautiful. Yeah. So hospice, just for review, provides it's, I describe it as a um, philosophy of care, honoring individuals in their final stages of life, and generally 6 months or less prognosis qualifies you to get into hospice. So it's a philosophy of supporting people to die with dignity, really, and self-determined life closure is the term that's used. And it's also a system in place to deliver that care. And so that system includes a physician, nurse, case manager, social worker, chaplain, and volunteers, and CNAs. They're key. Um, and that system can go into a nursing home, a residential home, a group home, or can be delivered in certain cases in an inpatient hospice facility. And so not all communities have a residential component to hospice. So the inpatient facility I worked in Asheville was a 26-bed inpatient hospice facility. And it was incredible. It offers incredible services, incredible support for families, and it has become much more regulated and highly medicalized. So you have to have medical criteria to be admitted into an inpatient hospice, or some symptoms that aren't managed in your home that qualify for you to be in that hospice. And it's not long term, it's not residential. And so this social model for hospice offers that residential piece when somebody doesn't have a home to go to or doesn't have family to care for them that otherwise might end up in a nursing home or back and forth into the hospital. And so this, I just wanted to name that that's a distinction between the social model for hospice and the medical model for hospice.
And thank you for that clarification. You also mentioned that we can learn more at omegahomenetwork.org. Did I get that correct?
Mm-hmm. Mm-hmm.
Okay. And finally, now towards the end, Aditi, I know that your Center for Conscious Living and Dying really helps us become more aware of the thin veil between life and death, and that this is so manifested in the new documentary about the CCLD called The Last Ecstatic Days. This is a powerful documentary. So if you could just tell us a little bit about the movie and how people are listening to this recording can see the last ecstatic days.
Thank you, Sarah. So to tell the story of CCLD, it's sort of the last ecstatic days is the founder's story in many ways. And it wasn't necessarily in connection to the Center for Conscious Living and Dying as it is now, but it was very much instrumental in the evolution of CCLD. And I was living my life on 2021, kind of in the pandemic still, during the pandemic, still working at the 26-bed inpatient facility. And um, CCLD had been a seed planted many years ago with Cassie Barrett from Carolina Memorial Sanctuary. I had started it, and then she joined and was involved for a couple of years. And it was really a passion project before 2021. It was something I was doing on the side. I have 3 children. Life was busy. It's more going to be an educational platform. And then 2021 comes along, and I get a call from my friend Jojo Silverman, who's a Kirtanvala musician in town I played with, a dear friend. He said, there's this young man, this soul, Ethan Sisser. He's 36, dying of a brain tumor, glioblastoma. He was diagnosed during the pandemic in Brooklyn when it was really intense there. And he started streaming his journey with cancer, his life and death journey. At first, it was just to support people who might be dealing with similar issues and showing holistic approaches to being with the cancer and treating the cancer alongside Western medicine. And so fast forward, he came down to Charlotte where his dad was living at the time and was admitted to an inpatient hospice by the time I connected with him. Another inpatient hospice facility, which is a wonderful place to be, not quite reflective of how he lived his life in community and with lots of ritual and ceremony. So Jojo calls me and says, this young man needs our help. He put out into the universe he's dying and he wants to be in community while he's dying and he wants to film his dying process. These 2 things are his last final wishes. So 2 weeks before Ethan finally crossed, I got that call. And Jojo also called my friend Scott Kirschenbaum, a director of films who just started working with Jessica Zitter in consulting in her company, media company. Jessica Zitter did Extremists on Netflix and a wonderful person. I got to meet her. I got to see her on stage at Endwell in 2017 and then finally got to meet her virtually over this journey, but during this time. So Jojo called me and Scott, and then it was sort of this moment of, okay, here we are. He called me because I was a community organizer in Asheville and a doctor and could support him as a doula as well. And so that was a moment where everything just sort of came into alignment, and it was clear this is ours to do. And what unfolded from there was what's captured in the documentary. And it really was, everything was very organic and sort of responsive to whatever was needed. Initially, he got to Asheville, to the facility I worked in, and they declined his request to film because of fear of COVID and also just fear of what could be revealed in a documentary, I suppose. I don't know, fear. It was the reason, um, though not implicitly stated. And so at that moment, I had the choice of getting him to a home setting or keeping him at the facility. And I asked him, I said, you know what? These are the options. We could film on an iPhone or do something smaller on a smaller scale. He said, it's worth every penny I have, which he didn't have much. It's worth everything I have to make this happen. So we rallied, quickly found a home that a friend opened up, and brought in the community and offered him an experience that reflected his beautiful, rich life. And during that 2 weeks, um, many people came up to me saying, "Hey, this is so enriching. This is so wonderful." People were just so ecstatic. And can we do this? Can we buy a house? Can we just do this for each other? It's time. And so from that journey, I had a whole mystical experience around in those 2 weeks, um, which is for another time. and and that it became clear after he died and crossed over that um, I was going to put my notice in, not knowing what I was going to do, how I was going to pay the bills. It didn't even matter. It was so clear. And that led me on this path to the evolution of CCLD as it is, which is, I haven't shared that. I know that was your first question. What is it exactly? Um, so I'll pause there. Is there a long, short story?
No, but people need to know. They can see and read
Yes.
about Omega Network homes, and then they can also take a deeper dive with this beautiful documentary, The Last Ecstatic Days.
Yes, and currently you can go to kinema, KINEMA.org, or .com, sorry, that's a .com, and look for any online screenings. We have one coming up with Reimagine and the You're Going to Die group on Monday, the 28th of October. So you're welcome to sign up for that through I think it's on Reimagine platform. Or you can go to thelasticstaticdaysmovie.com and see if there's any upcoming screenings. They're continuing. Right now, it's not really available for private screenings. It's very much a grassroots sort of let's get communities together, watch this together, and have a conversation about it. I think that's really my hope, is that it catalyzes your own inner, mm, yeah, just something within you that allows you to be creative in your own community, however that looks. And whether it's exactly the same version as Ethan or not, everybody's going to die differently in some way. So, yeah.
Thank you for sharing that. I was just able to see it in Chapel Hill.
Oh,
We did that
wonderful.
screening at the Seymour Senior Center there. Well, Aditi, this was,
Wonderful.
I just appreciate this so much. And I know this is going to be so well received by all those who had hoped to meet you or hear you from Seattle.
Thank you.
We're just,
Hi.
we're just so happy to know that you and your family are okay. And
Thank you,
yeah,
Sarah.
I just want to thank you again. And at this point,
Appreciate
I'm
it.
gonna stop the recording.
Sure. I realized I didn't tell you more about CCLD. Is that okay? Are you good with that? Do you can learn more. There's more. It's partly on Omega Home, but it's more than that too. So I'm happy to share that another time if
Let's go ahead and share how
okay.
people learn more about the Center
Yeah.
for Conscious Living and Dying.
Thank you. Yeah, so the Center for Conscious Living and Dying is really a hub for community supported death care in our community. And we offer the direct care Omega Home model of care, which involves a lot of preparation for the volunteers. So education is a big part of what CCLD brings to our community. And we also offer a space for community engagement and enrichment and experiential engagement. So a lot of events and programming around connecting with ourselves to really help us prepare for our own deaths ultimately and to be of service to those who are dying. And you can learn more at www.ccld.community. Thank you.
Thank you for sharing that and for doing this today. It's the sun is coming in, so
Okay. Thank you so much, Sarah. And thank you, everybody, for listening.
take good care now. And I appreciate it so much.